Today we talk a little bit about the prostate. Now, the prostate is a big fear for any man. It's a type of thing you don't actually know where it is located in your body, and when you hear the word, you only hear trouble. Because there are a couple of fears about the prostate. Number one is the fear of cancer. Number two is the fear of the rectal examination, which keeps many people away from the urologist because he doesn't want that personal insult on himself. And I just want to get that out of the way. One must be realistic about the rectal examination. It's part and parcel of the examination of the prostate, and it's not really painful. It is more an insult to your personal space, and that's the thing that one must get around with. Now, the prostate is situated below the bladder. If we could look at this picture, this is the bladder here, that is the prostate, that is the urethra going through the prostate and then going through the penis where the urine goes to. Now, the function of the prostate is actually to make the ejaculate. So if a man has sexual intercourse and he has a sperm emission, almost 98% of that fluid comes from the prostate. It's the carrier medium for the sperms. It also has a secondary function in that it is part and parcel of the control mechanism of the bladder. Now, what I'm going to talk about now is benign or non-cancerous prostate enlargement. When that happens, there are cells situated in the central area of the prostate surrounding the urethra that starts to enlarge and increase in numbers. A new tissue actually develops inside the prostate. It starts growing and it actually pushes the prostate to the outside, to the effect that you, in the end, the old normal prostate that you were born with is just a rim of tissue around this enlarged, benign or non-cancerous tissue that developed in your adult years. A fair percentage of men is going to be afflicted by this condition, and that usually leads to urinary problems. The mere fact that the prostate enlarges is of no consequence, but because you urinate through the prostate, if it enlarges and obstructs the outflow of the bladder, it endangers the bladder function. So the big prostate, if it needs management, is only needed because we have to preserve bladder and kidney function. Now, the symptoms of an enlarged prostate, the old term used to be prostatism, but we have changed it now to LUTS. LUTS standing for lower urinary tract symptoms. As it's wider defined because it's not only an enlarged prostate that gives these symptoms, also an abnormal bladder or urethral problems or obstructions can mimic these symptoms. But by far, the most common reason for these symptoms of LUTS is an enlarged prostate. I like to explain it in the following way. It's like the man going to the toilet. The first symptom of LUTS is you start going more frequently. You get the urge more frequently during the day, and you have to start getting up at night, which you never used to do, or maybe went once, to go to the toilet and pass urine. That's the first symptom. The next symptom is now the man gets up, he goes to the toilet, and when he stands there, he can't start the urination. He's got hesitancy of urination. When the stream eventually starts coming out, it's a weak stream, which is the third symptom. And then, when he wants to stop urinating, he can't stop. When he pulls up his zip, there's a few drops in the pants as well, and we call that post-micturition dribbling. The last symptom of the enlarged prostate is total blockage of the urine outflow, which we call retention. of urine. So the 5 symptoms of LUTS is frequency and nocturia, number 1, hesitancy, a weak stream, post-micturition dribbling, and retention of urine. If you have any of these symptoms, it's worth having it looked into. Now, there is one fear that I want to put aside now, and that is the fact that a man doesn't want to go to a urologist when he has these symptoms because he doesn't want an operation. You never have to take an operation, and the majority of patients with these symptoms, we actually do not operate in the modern management of urology. You are either giving symptoms or tablets, or if the symptoms are not that severe, you can be managed just by follow-up and making sure that the bladder is not being endangered. The mere fact that the urine flow is not as strong is not that important. One can live with that as long as you know that your bladder is going to continue functioning to the end of your days. So the urologist will test you. He will do a flow study, determine the strength of the flow in a flow meter or machine that you urinate into, and he will check with an ultrasound how big the prostate is and whether the bladder empties. He will also do a rectal examination, as that can give an impression of whether there could be an associated cancer, or it can give an impression of the size of the prostate if surgical management is considered. The treatment of the benign prostate is either conservative with medication, where 60 to 80% of people really fall under, or surgical management. And the principle of surgical management is removal of the inside of the prostate, that enlarged part that developed in your adult years. I stress, it is not removal of the prostate. It is only removal of the part that enlarged in your adult years. There are many different techniques of how this can be done. Actually, I think there are 16 different types of surgeries that can be advised. But my advice in this regard is you comply with what the urologist you consulted advise you, because that will be the type of technique in his hands where he will be the most comfortable with. If you're not happy with his advice, rather go to somebody else. If another form of management can be considered, let it be done by somebody who has experience and who is comfortable with that form of management. I want to end up with the fears of prostate surgery. What is the side effect of removing the inside of the prostate? The one thing that will happen is you lose your ejaculate, meaning when you get an orgasm during sexual intercourse, nothing will come out. It goes into the bladder. We call it retrograde ejaculation. That is a given. It will happen. The other 2 potential dangers is erectile dysfunction or incontinence. Incontinence meaning you can't control your urine. You have to wear pads or protective measures in a specific way. The risk of erectile problems and incontinence with benign prostatic surgery is almost nothing. It's negligible. So it is a low-risk procedure to have the inside of your prostate or a subtotal prostatectomy done. It can really save and change your life in the long run. Please don't have unnecessary fears about complications that is most likely not going to happen.